Now, with this basic knowledge of physics, we can move on to our ABC approach and start with the first thing, that is airway. Now, the utility of ultrasound in airway is first to first determine whether airway is difficult or not. Second, to help guide endotracheal intubation, to confirm whether our tube is placed in the right place or not. In fact, in the current ACLS guidelines, ultrasound has also been incorporated as a tool to confirm airway, correct endotracheal tube placement. Besides that, we should always be prepared as clinicians to deal with the worst kind of scenarios. For example, if we were to face this kind of a patient with this large swelling in the neck, with a difficult or a compromised airway, and we want to go in for a cricothyroidotomy in an emergency. Obviously, palpation is not going to help me because of this large swelling in the airway. The airway may be totally kinked, deviated, in all probability it is kinked and deviated in this case. And unless I know where exactly my trachea lies, there is no way that I can go ahead and secure the airway of this patient with a cricothyroidotomy or an emergency tracheostomy. So, how do I go about it unless I know where it is? So, this is where the ultrasound comes into play. As we can see in this patient, the airway has been grossly displaced, much to the right, totally displaced to the right and lying somewhere on the side. And if we place ultrasound probe along my trachea, I am going to be seeing this series of black small rings. These are the individual tracheal rings, and the bright white line which is beneath the tracheal rings is the air tissue interface. As I told you in the previous part of the talk, that air produces bright white artifacts. So, there you can see the continuous air artifact.